We can't hear you. You're muted.
Yeah. Hi. Hello, and welcome to this discussion on the many manifestations of workplace stress and how we can address it, how we are addressing, and maybe also a bit about how we are not addressing it. I'm sure all of you are familiar with the recent case of the EY employee Anna Sebastian Perail. Um, she came into the limelight after her mother shared on social media a small note that she had written to the employer, to her daughter's employer, after her daughter's death. And she claimed that her daughter had died of work related stress and being overworked by her company. Of course, there were other charges also being made against the company, that no one attended her funeral, and she wasn't given a forum to raise her complaints, and she was just, willing to please and wanted to work, because it was her first job too. So, from this sort of tragic incident, we realize that workplace stress is a real thing. Most of us are guilty of, probably overworking, probably not taking care of ourselves health wise, mentally, or physically, doing our regular checks. In order to give this work related stress a context, we at the Hindu have organized this event today. And we have with us very, very eminent people, who will be able to bring in various aspects of what constitutes work related stress. How do we plan to and prepare to face work related stress, because it is a real thing? And how do corporates actually incorporate employee welfare into their scheme of things? So today we have with us Dr. Thara, who is um, welcome, Dr. Thara. She is the she is a co-founder and vice chair of SCARF, and she's a veteran in the field of psychiatry, and I'm sure she will be able to give us perspectives of how exactly stress impacts on our mind and body. We also have with us Ramkumar Ramamoorthy. Welcome, Ramkumar. Hello. Um, most of you might be familiar with him. He's at most conferences, and he's speaking the side of the corporates. Ramkumar, who himself confesses that he works quite a bit, was with Cognizant. He was formerly with Cognizant. He was also with CII, and he is also an entrepreneur. He is an employer, so he brings to us multiple sides of the corporate point of view. Thank you so much for joining us, Ram. We have with us Dr. Sathya Sriram. Hi, Satya. Satya was a colleague of mine at the Hindu, and she is now with Apollo Hospital. She's the CEO of Preventive Health, and she actually has a minefield of data you know, from people. Clearly, they belong to corporates. They belong to, society in general. Minefield of data on health parameters, and she is able to draw certain conclusions that we will be happy to learn from. Welcome, Satya. So let's begin now with sort of trying to give ourselves a basic grounding on what stress actually does to our human body. How does it affect the mind? Is it something you overcome? And are there any tools in the playbook for us to follow? Dr. Tara, can we have you on this, please?
Yeah. Anyway, thanks to the Hindu and to Ramya. Of course, this is very topical, but this is nothing really new, Like many things in life, it's only a tragedy that often brings to the forefront an issue that has been there for many, many years. And over the last 40 years, I have seen people getting stressed out by work, whether it is in the formal sector or the informal sector or agrarian sector. leading to farmer suicides and so on. Um, but basically, what I want to say now is we have a lot of figures and statistics. Like, for example, the WHO says 12 billion working days, 12 billion working days are lost because of depression and anxiety produced by work stress. So, the commonest problems are depression and anxiety. But increasingly nowadays, we are talking of emotional well being rather than uh, emotional disorders. So how much of well-being or emotional well-being does the employment situation really foster? That is something that we have to look at. And honestly, Ramya, if I were to tell you, quite often we talk of physical health issues in response to stress, blood pressure, diabetes, aches and pains, and so on. Feeling tired, lethargic, not sleeping well, no appetite, various other things. But I do believe that the underlying factor very often is something emotional. But because it is not seen so much, uh, I'll tell you why. If an IT professional comes to me and says, I have pain in my neck, yeah, it may be because of his posture, he's not moving around. But if you really spend time talking to him or talking to her, him or her, you will find that there is a lot of underlying depression and anxiety. And this is what we have seen in people who have joined very recently, like this, like a case which you just narrated, very tragic, because these women want to prove to themselves and to the world that they can do it. What I have also seen is women are slightly more vulnerable to this than men are, because women often have to convince the families to move from the one place to the other to take up a job, and then they have to, it is more of an internal pressure that women create within themselves rather than external pressure. For men, a lot of external pressure in terms of financially supporting the family and career growth and so on. But for women, I find it is a lot of internal pressure that they themselves set it up, and they say, I have to prove it to myself. I have to prove it to my family. I have to prove it to my peer group. So they go on and on and on without any rest, and the stress really builds up. And unfortunately, in today's working situation, even take an IT firm, there may be 100 people in a room, but how often do they talk to each other? How much time do they spend with each other? There is hardly any socialization going on. I remember going to old time AG's office or Reserve Bank where a lot of people used to talk to each other. Now I find it's not happening at all. Maybe they send WhatsApp message or whatever. But this kind of social relationship, forming a social relationship at your place of work, I find is diminishing. Very often I have asked, who are your friends? Like friends say, "Kadayadu, madam." I say, why? Because we're all at work, they say. We don't have any time. We don't have any time to socialize. I do believe that peer support and support of the management and the establishment is very key to managing stress. If the person does not have time or the right kind of supportive individual to talk to, then the stress levels are going to escalate so high that at some point of time it will break down. Either they have a physical problem or they'll have depression, or and then even leading to suicide. So when you say that a person died because of stress, it's a very tricky kind of statement. I mean, you really don't know what killed the person. But we're all professionals. We all want people to be happy. We want young people to be happy. Why are they working after all? Ultimately. So physical health, what I'm trying to say is mental health is equally, if not more important than physical health, because very often it is not discerned by the individual or by the others. And also, I have seen many establishments don't respect the person when they complain of depression and anxiety. They think it என்ன சும்மா உனக்கு எப்போது இந்த மாதிரி ஐடிட்டு இருக்க இல்ல எப்படி சொல்லிட்டு இருக்க uh, they do not realize the seriousness of what the person is going through. But if there were a support system, I'm sure Mr. Ramamurthy will talk about it, but if there was a support system in place, then it will definitely help. I'm not talking of just a counselor. A counselor cannot solve all the problems. But I think as human beings, we are losing our innate capacity to network within our workspace. We're losing it. We blame it on work, we blame it on timelines, and we blame it on whatever. But I don't. When I enter an office now, I don't see happy people. I see only tense people. So that is something we have to address.
Thank you so much, Dr. Tara. I'm also glad you brought out the nuances of this particular case, and it's difficult to say yes that someone did die of stress. It definitely was a contributing factor, which is why the Hindu didn't want to rush with sort of a seminar even earlier. We wanted to wait for a bit and talk about workplace stress as an issue, though the Eva incident is only a peg. And thanks also for bringing us to the corporate side of events and pointing out that women are multiply disadvantaged in these situations. Now, I'd like to bring along Ramkumar. Um, Dr. Tara has sort of, dragged you into this conversation as is must. I'd like to ask you: has the corporate world become more competitive in the last decade or so, or has it failed to adequately support its employees in the last decade? Which of this is true?
Yeah, yeah. Thanks for the platform. One, I think we should all understand that the corporate world is only a microcosm of what happens more broadly in society. Uh, Over the years, I think both as society as well as individuals, uh, we have set certain priorities for ourselves in our lives. How we measure success or happiness has been redefined. There are certain elements of life that we seem to be glorifying, and certain elements that we underrate, so on and so forth. A lot of it starts there, and probably it also gets translated to the corporate world. We seem to have created certain templates that define success, happiness, so on and so forth. Just look at certain templates. Why is it that everybody seems to prefer engineering or medicine after their schooling education? Why is it that we seem to glorify IITs and come out with headlines saying that 73 of India's top 100 unicorns have at least one founder from IIT? Why is it that there is an outsized focus on placements in campuses and that driving a certain behavior in the marketplace? So I think as a society, we seem to have started defining success or happiness in a certain templatized fashion. And there is a need for us to reset or reimagine so that the focus is on well rounded individuals, which also includes health, happiness, and wellness. I'll give you one example and then quickly switch over to examples from the corporate life. About maybe 5 or 6 years back, I was at a conference here in Chennai, and the conference was moderated by one of the leading journalists from Business India. And she asked a question to the panel of industry leaders: will Tamil Nadu ever produce a company with 50 or $100 billion in annual revenue, just as we have examples from the north of India in the Ambanis, the Mittals, or the Birlas? One of the leaders from the Murugappa group on the panel said, we are eminently happy running profitable companies with certain values and ethics. Do not try and then bring a template and superimpose it on us. Do not measure us by different yardsticks that are not germane to our ethos of running a business. The reason why I'm bringing up this example is largely because I think over the last 10, 20, 30 years, we seem to have started applying certain templates that is driving behavior, not just in the corporate world, but in everything that we do. So coming to the corporate context, progressive companies actually have certain policies, certain systems in place to manage workplace activities. And many of the large companies actually prepare for events which could potentially trigger fluctuations in workload and usually have solutions in place very well in advance. This could be very different for companies across industries and sectors. Let me give you a couple of examples on how they manage it. I think we are having this conversation on September 28. For auditing companies, this is just a couple of days away from half-yearly closing, just to meet certain statutory deadlines. And many organizations send their data almost at the same time, and there could be a deluge of work that could come into many of these auditing companies. Likewise, we have the peak holiday season coming up for retailers because of Diwali. Companies always have flexible resourcing options to meet these peak requirements. There was a mention of IT companies earlier, having spent a little over 30 years in two of the largest employers in India. I can tell you one fundamental shift that the IT companies started with. Unlike manufacturing, almost everybody, there could be some exceptions, opted for a 5-day week or not a 6-day week. While companies are allowed to work for a certain number of hours in a week, many of the companies settle for much lower number, anywhere between 40 to 45 hours, and in a 5-day week context. They always had shadow resources on every project or program, and the workforce utilization, all this is public information, has always been anywhere between 75 and 85% in India, accounting for discontinuities that could happen while running the business, accounting for holidays, learning, other time off, so on and so forth. And these companies are also extremely sensitive to certain events in the corporate world, handling performance management on a periodic basis and the consequences of performance management. So there are two broad things that companies have done. One is to have invested in an employee assistance program where any employee, if they find that they are getting close to being stressed, there is a certain number that they can dial into, certain organizations that have been empaneled that they could probably go to get counseling support. There are mandatory annual health checkup, so on and so forth for certain categories of people. But I need to tell you, having worked for global organizations, that the number of people from India actually picking up the phone and seeking counseling support is much lower than many parts of the world. In fact, when I used to look at data on a periodic basis, I was very surprised that folks in India, at least the percentages were in single digits relative to very high percentages in many parts of the world. I think it's incumbent on all of us to do what it takes to take away this reluctance and also the stigma that is attached to reaching out to a psychologist or a psychiatrist and seeking counseling support. Every large company has hotline numbers for any whistleblowing that needs to be done. And many companies have very progressive supportive policies, flexible working hours. You look at the hybrid model. Today, even after 2 years after the pandemic, many of the organizations provide this hybrid working model to their employees, at least in the tech industry where it's possible. They support the use of paid time off, provide resources and support that are actually needed for people to ensure that they are healthy and they are well. So I would probably say that systems, processes, resources are in place. One, can we implement things better? Absolutely, yes. Can we, as a society, starting from school to college to the corporate world, do things in a much better fashion? Absolutely, yes. But as you see, this is a journey. I gave you the example of the employee assistance program. I know that's been around for almost 20 years, and even today, the usage is very limited. I think we also need to remove some of the stigma that is attached in the societal context so that we get more and more people access what is made available so that it adds to their emotional, physical wellness.
Yes, thank you so much for that. It's it's heartening to see that companies are moving away from the so-called Narayan Murthy 70 hours at work per week model. He himself, of course, worked 85 to 90 hours, but then there are different strokes for different folks. Thank you for bringing in the stigma angle as well. I'm sure we'll have some questions on that a little later. I'd like to go to Satya now. Um, Preventive healthcare is a very, very valuable part of uh, corporate life, of life today, in fact. Um, so, do you see a large number of youngsters coming in to do preventive healthcare checks via their companies, or do they come individually? And how much importance are they giving to the results of these tests? Do they follow up? Do they take action? Do they go to the doctor? Do they go to the specialist after? What are your thoughts on this?
Thank you, Ramya, and the Hindu group for organizing this. I think it's a pertinent topic, regardless of the recent unfortunate incident. I think it really motivated us to get together. So thank you for providing this platform. If I step back and say, why is preventive health important today and what it covers? I think firstly, it covers what I'm going to call broadly non-communicable diseases. Things like diabetes, hypertension, heart disease, obesity, cancers, and increasingly now mental health disorders as well. If you look back to the last 30 years in India, there has been a significant rise in the number of people with these chronic conditions or non-communicable diseases. And the earlier we're able to identify them or even determine if you're on the path to contracting them, then we are able to actually manage those conditions far better. So, one of the things that we actually wanted to do more of is as people were coming in and thinking about their health checkups, expand that definition beyond the usual blood tests and x rays and mammograms that we're thinking about to include aspects that are impacting our mental health. For example, we have a questionnaire around depression and anxiety that allows us to help people determine simply by answering those questions, you become a little bit more aware of what you're going through. We look at sleep, which is one of the underlying causes of stress as well in your body. And so we help people understand whether they have sleep issues or not. So, like this, we have several lifestyle assessments, as I call it, that help determine where you stand. And when we look at some of the responses that we've gotten from these assessments, right, we find, for example, 1 in 5 people actually have depression and are in the 18 to 25 age category. That's fairly young for that age category to be depressed. These are folks that are just starting out in life. They should be full of energy and vitality to tackle the world. Instead, 1 in 5 of them has depression. Again, if recognized early, can be fully treatable. We looked at self-reported significant stress. And we found that about 70% of over 10,000 people self reported significant stress. And what was more interesting is that we found the age groups of 18 to 30, so the young, and those who are greater than 65, these two populations actually had very high levels of self reported stress. So they are starting to recognize this, which then allows us then the ability to provide them subsequent care programs and pathways to be able to provide the help and support that they need to be able to overcome this. The other point I want to make is sometimes this is manifested as stress in mental health, but there is also significant intertwining of biological factors of our body. These are chemical or hormonal imbalances, genetics, gut issues. All of these tend to also impact our mental health. And so there is a not sort of a separation of the physical and the mental, but almost an intertwining of the physical and the mental health. And we have to look at the body as a whole to be able to help people understand what is going on, get to some of the root causes, treat the symptoms and the root causes to be able to set them on the right path. I fully recognize some of the issues that we've, or solutions that we've shared earlier, right, around what I'm going to call the community that surrounds all of us. Mental health is very, very hard to diagnose and even harder for individuals to come to terms with. I think if we start to make counseling the standard, not the exception, it'll do all of us good. And that's one of the things that we are striving towards, is to talk about it as counseling and deviate from the words of mental health and psychologists, and to make it much more acceptable amongst people to seek support, whether it is medication or therapy, to speak and to air their points of view, and then also to pick up specific activities that can actually help them manage the stress, the sleep, physical inactivity, all of these that are contributing to the overall condition as well. The last thing I want to leave you with is we find that when people have chronic stress, I want to say that stress in small doses is actually a good thing. It helps us focus, it helps us actually do better at whatever task we take up. But chronic stress, that means prolonged periods of high levels of stress, actually causes much higher chance of having diabetes, hypertension, heart disease. And so this, in fact, in addition to the immediate need of mental health conditions to manage, also sets one up for longer term unhealthy conditions. And we have to actually keep that in mind as well as we think about the long-term effects of mental health that our population is now grappling with.
Yeah, thank you. Yeah, that's simply staggering, the kind of figures that you're talking about. And I think even as the nation worries about pandemics, then here at our hand is a larger, healthcare pandemic, as it were, which we need to be paying attention to. This also takes me to Dr. Thara back again, where I'd like to, throw open the question. Um, how does one recognize stress in the body? Is it possible for us to see what stress is?
See, I have had school children aged 9 and 10 telling me that "Ray tension." How do they know it? They could be picking it up from the school, they could be picking it up from the family, but they kind of know that there is some change that is happening in their bodies or change that is happening in their minds. They may not come up with diagnostic formulations, but the key is, am I the same as before? Is my body the same as before? Am I having more headaches? Are my neck muscles tightening much more? Am I having aches and pains? Am I getting tired more easily? Am I getting more irritable? Am I falling foul? You know, and then at the end of the day, do I feel that, okay, I just have to stop all this and say goodbye to my work? Very often people have come and told me that they feel this 4 times a week. I think to me, these are the cardinal signs of stress. There are many, many more. You could have palpitation, you could have anxiety, you could have many more. But without giving it a name or a diagnosis, I think basically what people should look for is any change, perceptible change in their bodies or in their emotions, or even the way they cope with situations. I was able to cope with a 10-hour job, but now I'm finding it so difficult. I'm burning out. After 6 hours, 7 hours, I feel like throwing out everything and walking away. You know, so these are the things that we should people know and identify as stress, and very often they are right. Very often they are right.
The other thing is the attitudes of the public itself. The word stigma was used here before. Do you think there has been a welcome change in the way people approach mental health now, more so than in the past? And of course, even if much more needs to be done, and how do we do it at a corporate level?
Surely, I mean, I can say last 30, 40 years, there has been a change, more people walking in. And what is good is more young people walking in, which means that there is some amount of what we call insight. They know what is happening to themselves. And they may not come with families, does not matter. At least they have taken the courage to seek help. Regarding stigma, I still remember when I was in IIT as a psychiatrist, the boys would come into my room and say, "Madam, are you doing private practice anywhere? We will come and see you there, because we don't want to be seen in IIT as entering your room." Even now, I'm not sure if that situation has changed very much. People are, for example, you have college counselors, but how many of the kids really go to them? No, we are not very sure about that. So the only way of one way we have started, and in fact, it has become globally a very popular concept now, is peer support. Peer support is some people in the office, some people in the school or college being trained to offer support. I mean, let us not even call it counseling. That will go a long way, because that will beat the stigma of going to a professional counselor. But true, at some time you have to go to a professional counselor, but this could well be the first step that you take in talking to one of these peer support people and saying, "I'm having a problem, I'm not sleeping," and then the referral can happen. Then it becomes kind of easier.
And maybe one question also about varying levels of stress. Clearly, everybody reacts in different ways to different stimuli, and it's not possible to sort of measure one by the other. So, in these circumstances, does depending upon how a person is reacting to the stress around themselves, do you think is it possible for organizations to watch out for and address particular individuals in this case?
The point is, organizations can talk about their performance at work and the productivity and the way they relate to, let's say, the boss or even their peers. But that is not all of it. I think it is that is why right at the beginning I was saying that people in the office are not interacting with each other enough. If they did, then they'll be able to spot a change in their friend or in their colleague, and then they say, "This is not the same guy. There is something happening to him." True, there are various levels of stress, but if you catch them early, all of them do not require counseling. They may require only a change in lifestyle, more sleeping hours, taking good food, going out to the gym. uh, and and some kind of relaxation which none of these young people are ready to build into their lives. So I do believe that the entire ecosystem of the place has to change, whether it's a college or it's a corporate or even an informal work setting. If it is tuned to detecting emotional disturbances and behavioral changes in the person, then you catch them early. Ramya, unmute.
Yeah, hi. Sorry, I had a little problem unmuting myself. Thank you so much for that, Dr. Thara. I think there are a lot of valuable lessons, and I hope some representatives of corporates or are going to be listening to this because there is much we can derive from this. Now, having come to the workplace, let's go over to Ramkumar again. Um, Earlier you spoke about systems being set in place in most corporates. There are there is succor in case you want to reach out. There is help, there is a system in place, there are counselors. But as far as the awareness goes among the corporate crowd, is there an awareness? For instance, sometimes, it's very difficult to bring people together for an event that is not technically work related. So, how does one change that culture?
Yeah. No, I think many of the corporates realize that everybody has to be sensitized to some of these opportunities that are available for remediation. Uh, so, in many of the organizations, this sharing of information starts from the induction. As and when people join in, when they join in large batches, we actually have people from the human resources team spend considerable time talking to them about what systems, what processes, uh, what options are available to them to voice, to share any concerns or grievances that they have. That has actually helped. Second is whenever we have sessions with the leaders, we try and get leaders to talk about uh, their own personal stories, if in case they've been through a similar situations and how they came out of it. I think if we can get some of the role models in the company and also in society to talk about it, then evangelizing some of these is a lot easier rather than merely have it in documents that you share with your employees. Let me give you a couple of examples more from society where this has made a meaningful impact. I think depression, anxiety uh, came to be recognized as something that any one of us can go through when Deepika Padukone came out in the open and shared what she went through. Or when Mukesh Ambani and Neeta Ambani came out and then said that they had their twin children through IVF. So I think if we can start getting the leaders to become role models, if in case they have been through it, then more and more people come forward and then say, guys, look, this is very common. Everybody seems to be going through this, or at least a cross section of the people across levels in the organization seem to have experienced it, and therefore it's a lot easier for me to go out and then get this done or talk to somebody. The point that Dr. Thara brought up, I think, is extremely important. People tend to be very comfortable talking about niggling issues amongst their peer group rather than talk to people outside their circle of influence. I think if we can get this going at scale, that can be a real solution. I know it happens in pockets, but I don't think that is something that is institutionalized. I think well-being. I remember many years back listening to Dan Buettner of National Geographic Channel. He did this big exercise of going across the globe and identifying 5 or 6 locations where people live to 100 years or more. People are very healthy physically and mentally. And he called these blue zones. And one of the aspects that keeps people very healthy physically and mentally is when they actually sit around and discuss with their friends, very close friends, and have a chat in the morning or in the evening, discuss everything under the earth and have a hearty laugh. I think that that kind of a peer group has a meaningful influence on individuals across age groups. I'm sure that corporates can learn a lot of lessons from it.
Yeah, thank you. The other thing at the workplace, we've been talking about peers, is the I want to bring in an aspect here that may not necessarily be in the domain yet, but social media. So today we have social media like never before in the past. We are simply bombarded with social media messages. I mean, I don't think any of us can genuinely say that it is not in my life. Even in the case of the EY employee, we only heard of it through social media, and there's been a backlash on social media. So, in this context, there is a lot that comes out of social media. There is a lot of positive effect as well as negative effect. But what is the impact on companies, on corporates, on managements themselves? Do managements pay attention to social media? How much of importance is it given in terms of guiding their policy and their path?
I think it's very important that organizations take social media seriously. But at the same time, I think you also need to be aware that a lot of anonymization happens in social media. Look at it as another very important feedback channel for improve yourself. Uh, Even in the EY episode, right? I didn't want to specifically go down the path of commenting about what happened in a single organization because I don't think we have access to all the information in terms of what really happened. But it's important to understand that organizations need to be extremely sensitive uh, to any episode and be empathetic to the given situation. They will have to come out in the open. If something has happened, take full ownership for what has happened. If it is not germane to the organizational culture, make a mention of it, acknowledge what has happened, and see what best can probably be done thereafter to remedy the situation. This is not the time for you to come out and say things primarily to protect yourself. The fact that upfront they did not even acknowledge this happened at EY, but at a member company which was associated with EY, I think they lost the plot. And the second thing is to come out and then say that here is an employee who worked in the company for only a few months and has not been a tenured employee. I think people need to be extremely sensitive and empathetic and use this as an opportunity to address issues within rather than take a very defensive stance. But social media is what it is. If you're operating in an environment and you have opened up social handles and you're using the social media as a channel to present your point of view, you have legitimized that particular communication platform. So go ahead. And then you need to probably learn to use it rather than try and then uh, be very defensive about the entire stuff.
Yeah, I think that's great advice for anyone who's listening. Satya, if you can come in now. So we have, multiple measures now, to grade if someone is happy at the workplace, is content, is satisfied. Also click on to express happiness. Do you think, I mean, even if you go to a restaurant, you can tell them how happy you are or how dissatisfied with the service. Do you think it's possible with all the technology we have and AI, properly fed AI? Is it possible to arrive at a sort of a happiness meter, for employee and employer? You know,
Yeah, Ramya, are you able to hear me? All right. Yes, I think technology can do a lot of wonder, but I think we also have to be careful, right, on how it is actually built. So, one of the things that we have seen is several health tech startups have actually looked at either self reporting of a number of questions around different dimensions of one's life, bringing that together into essentially a score of your current happiness and stress levels. The more we can actually get something like that out to large populations, and be able to tag actually how many of them therefore are correlated with well documented, clinically established surveys like the PHQ-9 or GAD-7, and these are very, very clinically well established. That then allows us to build a model that can correlate these self-reported surveys with an appropriate determination of their stress and anxiety levels. Another set of health tech companies actually are looking to read the face, read postures, and see if they can determine the stress level based on that. So you almost can imagine a future where essentially, as you scan your ID badge, there's a camera that's capturing your face, facial expression, and then being able to determine your stress level. We've seen several demonstrations of this, Ramya. However, when we correlate that with the actual, again, clinically validated scoring and surveys, we're not able to see that yet. So I think while the goal and the intent is to be able to build such models, we're still in the phase of being able to correlate these. And once we're able to develop something that's robust enough, I think I'm hoping that we will be able to implement these in workplaces and several other locations that then allow us to determine not just what you self-report, but what your body is actually saying, and you may or may not recognize fully.
Yeah, yeah, that's interesting. I mean, there's hope for the future still. The other thing that you did mention earlier that you did incorporate, or Apollo incorporates a couple of questions on mental health. But in general, if you look at the marketplace that is a master health checkup, how much importance, if any, is given to measuring mental health care? Mental health, sorry.
Hardly any, right? Hardly any. And I think that this is unfortunately the reality of what the master health check has become. When we as individuals and consumers choose convenience over what is actually important to determine our underlying health status, then the market then also responds to that. So what I mean by convenience is most master health checks today will say, oh, do a full body checkup and get your blood test done. We'll come home, take your sample, and give you a report. Well, that's only one part of what your entire body is saying. There are others who actually do, again, a number of imaging diagnostics, saying I could do an ultrasound and an ECG to measure your heart health, and X-ray. And that gives a second dimension of what your health is. I think what we are all missing is this third dimension around what I'm going to call our lifestyle, right? And this is where we've started to introduce aspects of our life choices and life experiences that are also contributing to our health, and we are not actively measuring today through blood or imaging. And this is things like how well are you sleeping, how depressed and anxious are you currently. We have a little game, a set of games you can play that will determine your current cognitive function. And what I mean by that is essentially your ability to pay attention, focus, working memory. All of these essentially are a determination of how well your brain is functioning here and now. We also have added strength as a determinant. Our musculoskeletal system, flexibility and strength is contributing to aging. And overall, all of these aspects are therefore important to determine whether you are in a healthy and happy place to complement those blood and imaging diagnostics. So, to answer your question again, I don't think we're thinking about this holistically. We're not going beyond that routine, okay, it's convenient, go get that blood test. We do have to recognize that that's one important but only partial portion of our overall health status. And these are other dimensions we have to think about.
Yes, Satya. We have earlier had discussions on on how differently women view healthcare for themselves. And Dr. Thara has mentioned to start off this conversation about how women do suffer more in such circumstances, and the whole alienation bit from the family tends to impact women a lot. So, do you think there should be a specific, even if it's not voluntary, a mandatory component to test, particularly women, for any mental health disturbances? Because women tend not to talk about it physically, also, but also to a great extent, what ails them mentally.
I fully agree. And for example, when we look at our preventive health checks at Apollo, we find that 65% of those who come are men, 35% only are women. And therefore, right there is essentially evidence for what Dr. Thara mentioned in terms of women not prioritizing themselves. And I think that this is our intrinsic natural instinct to deprioritize ourselves and prioritize and care for everybody else around us. That is what makes us also biologically privileged. That said, I do believe that there are a set of tests that are important for women to think about for themselves. Mandatorily mental health, but like I mentioned earlier, there are biological factors that also impact the mental health, and we may not necessarily recognize those either. Hormonal imbalances, especially around sort of the fertility window and postmenopausal, are very important life stages for women. And these hormonal imbalances can also have a mental health impact. So we do have to think about it as specifically mental health, but also other hormonal aspects that are very unique for women, um, and nudge them, let's say beyond nudge, mandate them. And each person chooses to prioritize and nudge other women around them to be able to take care of themselves and prioritize themselves.
Thank you so much. That makes a lot of sense. I'm wondering if we can have quick comments from everyone on if you were to give someone working in a corporate a playlist, then what would you recommend that they prioritize? Someone who is working in a corporate setup. Maybe Ramkumar first.
I think need to get back to certain basics, uh, like providing resources and support to ensure that the foundational elements are in place. Second, it should be integrated with the larger purpose and evaluation systems within the organization. Let me just elaborate on that. Fine, everybody believes that in the corporate context, profitable growth is the only metric that companies are focused on. In fact, at least the organizations that I have worked in, there are three critical metrics with equal weightage. Profitable growth is only one of those. Customer satisfaction and employee satisfaction are two other metrics that are equally critical uh, uh, in assessing not just employees but also their managers. And third, there clearly has to be mechanisms in place if people are undergoing certain challenges to voice them. And I think everybody should encourage people to come out and freely talk about it, uh, so that we only create a more healthy organization in the process.
There's in the comment section, I see something about toxic working environments. Would you like to comment on that, Ramkumar?
I don't, I don't know what they mean by toxic work environment. See, please understand that I think Dr. Thara mentioned this, or maybe you started off saying that we are in a very competitive environment. Uh, companies gravitate, employees gravitate to organizations that have a great working culture. And if an organization demonstrates toxic work environment, in today's context where attrition levels, especially in the IT industry and a few other industries, are upwards of 10, 20, 30% uh, uh, over many years, there is a freedom of choice for people to leave those organizations and move to companies that actually provide a much better working culture. So every company strives really hard to attract the best talent and retain the best talent, and to ensure that the work environment is as conducive as possible. And which is also the reason why organizations do very regular surveys and form teams to ensure that certain open items are addressed. For example, in large companies, you have an employee satisfaction survey. You also have third party surveys like entities like Great Place to Work, which actually provides a certain scorecard across a battery of parameters to tell organizations where they are relative to their peer group in the industry, and generally overall. So companies take their culture very, very seriously. At the end of the day, what differentiates one organization from another is the culture and the experience, all else being equal.
Thank you so much, Dr. Tara. Your tip
No, I
to
just want to point out that all along we have been talking about corporates, right? But in SCARF, we have done a lot of work in Ambattur Ravli factories, right? And 80% of the people there who work are women. And the amount of stress they go through is immense. And they don't have any employment assisted program, nothing. I mean, there is nothing at all. I can tell you that much. Everything is target based. In one day, you'll have to stitch 1,000, whatever they're stitching, 2,000. And the other big problem is child support. Many of them are young women, young mothers, and they're all the time so worried about children. So there are very few places in Chennai, at least, which have a daycare facility. I believe that factories like this must have a daycare facility because otherwise the women will not be able to function effectively. And it really takes a huge stress off their minds if they know that the child is being looked after well. And believe me, there's so much of abuse in those places. I mean, I don't want to name them. More emotional abuse, physical abuse, and these women are working under extremely difficult conditions. Many of the husbands are they abuse alcohol, and therefore they are forced to earn something, whatever, to contribute to the family. So I do think that this kind of sector also needs a lot of attention, because a lot of our poor women are out there struggling there, and I do not know what kind of support they have.
Yeah, that's thank you for bringing that in as well. It's a very important part. Satya, do you want to come in now?
Yeah, so I have three quick suggestions for our corporate friends. The first is make sure that there is physical activity incorporated even in your day to day work schedule. Do standing meetings, do quick 10-minute walk, one on one meetings, because physical activity has been shown to actually reduce the depression, anxiety, and have a positive brain function. Second, work in mandatory pauses into your day. Even if it's 1 to 3 minutes, it's okay. The time duration is not important. The fact that you're working in a mandatory pause is what is more important, because when you actually do more mindfulness meditation practice, that can downregulate the genes of inflammation and actually help us manage our stress better. And the last piece, find your tribe. Loneliness and social isolation can be as damaging to an individual's health as smoking 15 cigarettes a day or sitting 8 to 10 hours at the workplace. You have to find your tribe, wherever that is, however it is. Please find your community and tribe.
Thank you so much for that. And yes, I think it's very important from this discussion, as our experts have pointed out, that it is so important to find your own peer group, to find your own tribe, in order to gather some support if in case you have a torrid time at the workplace. Thank you so much to our all our speakers, Dr. Thara, Ramkumar, and Dr. Sathya Sriram, for coming in here and sharing the valuable insights. I'm sure it's been a great experience for our listeners and for the people who will tune in to our YouTube later, as it has for me. Thank you all so much, and do tune in to The Hindu for more live discussions and videos. Thank you so much.